All right, May is National Cancer Research Month, and Cure for the Kids Foundation is Southern Nevada's only pediatric cancer and rare disease treatment center. Many of its patients also have the opportunity to participate in research studies and clinical trials. Here to talk more about pediatric cancer research at Cure for the Kids is Dr. Joseph Lasky. Good morning. Thank you for joining us.
Good morning.
Okay, so let's talk about this, because a lot of us have heard of the term clinical trials, but what exactly are they, and why are they so important for kids with cancer?
So Cure for the Kids is a member of the Children's Oncology Group, or COG, which is a group of pediatric cancer treatment centers from all around the country, and they exist to conduct clinical trials on children with severe cancers and devastating diseases. So being a part of this organization allows us to enroll children on these clinical trials, which basically are studies that allow us to test new therapies or medicines to determine the best treatments for these childhood cancers. What we know, and several research studies support this, is that children who are enrolled on clinical trials actually have better outcomes and better survival than those who are not on clinical trials. And then furthermore, the data we get from these clinical trials allows us to really define the best therapies for these kids. Currently at Cure for the Kids, we have about 40 clinical trials open with the Children's Oncology Group. And then in addition, we have about 10 clinical trials with other sponsors for a number of other rare diseases such as sickle cell and hemophilia.
Wow, I mean, and these clinical trials lead to just groundbreaking treatments, and clinical trials are different from observational or registry studies. What are those, and can you help us kind of understand the difference?
So unlike what I described above, where there's testing of treatments or different medicines and stuff, observational and registry studies really are used more for epidemiological research or to study the natural history or progression of certain rare diseases. And because a lot of the diseases we see in our clinic are very rare, sometimes there's just not enough patients to conduct regular clinical trials with medicines and stuff. And so what we can do is enroll children on these registry or observational studies and collect data that we then can share with patients and their families, or even other physicians around the world, to really to learn more both about the onset of these diseases and then again also about their natural history or progression. And
expanded access studies are also really important for local families. You have an example?
Yeah, so there are several very rare genetic diseases that have medications that are often only available at very large academic centers or even sometimes at the National Institutes of Health. And for families to have to drive to those places, oftentimes long distances, it would be a great burden, especially since they have children with these chronic diseases. So Cure for the Kids is part of a number of expanded access or compassionate use trials, which allows us to get access to some of these very rare medications and allow these families to treat their children in their own hometown in Las Vegas, and not have to travel long distances to get these rare medical treatments.
It's so wonderful that we have this right here in Southern Nevada. Thank you so much, Dr. Lasky, for joining us today. And if you want to learn more about Cure for the Kids Foundation, we've got the information on your screen right now, and more. We'll be right back.